Dottie McLeod with you until 10 a.m. here on BBC Radio Cambridgeshire. Now, you heard Emily Junior a few moments ago chatting about last night's clap for carers. I expect you've also heard about some of the problems that NHS staff are having in our hospitals, in our doctors' surgeries, with a lack of specialist protective equipment for dealing with infected patients. Let's get a sense of how serious that situation is by speaking to Dr. Katherine Henderson, who's president of the Royal College of Emergency Medicine. Morning, Katherine.
Good morning, Dottie.
Goodness me, I mean, even before any worries about protective equipment, I just can't imagine what a busy and overwhelming time it must be for emergency doctors.
We went into this having had very busy departments, having had a very busy winter. And now this has taken over as being the main thing that we're doing. And it is very busy. But if we talk a little bit about the protective equipment, that really, I think, is now pretty well sorted. We're getting kit out now to all parts of the NHS. It's getting out to hospitals. It's getting out to GP surgeries. It's now getting out, very importantly, to social care. And we had new guidelines published yesterday, which are incredibly reassuring for staff. So what we're hoping is that we're going to be able to kind of move on from the kit finding part of the problem and actually getting on with treating patients and making sure that everybody does what they need to do about staying at home and not making it likely that transmission gets greater.
The lack of available kit must have caused some real worries for some of your members.
It did cause worries. I think emergency departments were fortunate because it was obvious that we were going to need kit very early on, and similarly intensive care units. So in some ways there was more of a problem in primary care, where obviously an awful lot of patients are being seen. Now, I'm sure your listeners will be aware that their GP surgeries have largely gone over to teleconferencing now, so that they can do consults long distance. But there are still lots of patients who do need to see a doctor or a nurse directly or need to interact with their carer. And it was incredibly important to get that message out and to get kit to them. And hopefully that is now all happening. I think the logistics of this, such a huge business to get this amount of material out to people. It's really quite a challenge, but I think we're getting there now.
It must have been such a challenge. And, I don't want to kind of lay into the government and the powers that be on absolutely every tiny little thing, because I'm sure they have been trying their best and doing everything that they can to help. But do you feel that this has shown up gaps in the government response?
Well, I think no one knew how big it was going to be. This is going to be an enormous event for the country. People use the word unprecedented. It really is unprecedented. Yes, we didn't have the logistics set up to be able to deliver a huge amount of material to places just at the time we definitely needed it. But we're going to have to move on from that because there's going to be an awful lot more that we need to be doing. So my line is, the government's listened, NHS England and Public Health England have listened. We've managed to get guidance that we feel confident in. We're managing to get kit out there. The next part of this is, of course, people need to wear the kit properly. Just putting these things on is not enough. We still all need to be hand washing like anything. We need our patients to be hand washing, and we need our patients to be coming to hospital when they need to. But as much as possible, maintaining the social distancing and the stay at home message is just paramount.
And just to finish on something, Katherine, a bit more upbeat and a little bit more positive. The clap for our carers, which happened last night for the second time. I've been watching videos of it happening in places around Cambridgeshire on social media, and we're getting so many messages here at BBC Radio Cambridgeshire from people wanting to give shout-outs for NHS workers and other key workers. How much of a difference does that kind of support make?
It's so lovely. I can't tell you how effective that is as encouraging healthcare workers in their job. Lots of my colleagues describe tears in their eyes when they hear the clapping going on. So we're terribly grateful that that is happening. We feel the support. We need to be aware of social workers, carers, the people who are keeping our shops going, teachers, policemen, all these other parts of the system that's making it possible for us all to manage. But it really is a lovely gesture.
Katherine, really nice to talk to you, and do take care. Dr. Katherine Henderson there, who is president of the Royal College of Emergency Medicine. 6:45.
Across